Well, my name is Patrick, and I'm from Uganda, born, raised, and proud to be Ugandan and African, of course. I work for the Uganda Youth and Adolescents Health Forum and for the Africa Youth and Adolescents Network on Population and Development. And this is what we as young people want in the strategy. One, we want the strategy to have a multi-sectoral approach that looks into issues of women's empowerment, that relates MNCH into issues of youth empowerment, education, nutrition, and issues of water, sanitation, and hygiene. Youth-friendly services, I think that's key. It needs to call on governments to implement and have in place youth-friendly services that, and this should be integrated into the general health sector, entire system. It should address issues of safe abortions because there are quite a number of increasing unsafe and induced abortions, and very many young people abort. Then family planning, access to family planning, addressing myths and misconceptions behind access to contraceptives and family planning. Then the issues of age consent, because we have cases of young people being denied services because they are below 18, yet they're sexually active. So probably it's something that we need to look into. Then life-saving commodities. I think, and this should be very, very key, that at least for every mother who goes to a health facility, we should be in position to save their lives. We should have emergency obstetric and newborn care services in place, both at the lower and higher health facilities. We need critical health cadres that can save lives of mothers, like midwives, doctors, anesthetists, and others, to be attracted, motivated, and even retained in the health system. Issues of demand creation, and this comes with comprehensive sexual education among young people. But we want the component of comprehensive sexual education to have a component of safe motherhood, where young people are taught about issues of safe motherhood. So when they are pregnant, they know that it is important to go to a health facility for antenatal, to give birth from a health facility, to do postnatal care and other things. Then confidentiality, and this is key, of course, especially to the young people. Then fully equipped health facilities, want theaters in place, functional to that effect, with access to power, running water, and other instruments that are needed, like gadgets to save lives of newborns. Then we want it to eliminate traditional birth attendants. We don't want them anymore. Me as Patrick, as a young person, I think traditional birth attendants divert young people from going to health facilities, and they end up going to these traditional birth attendants because maybe they are slightly cheaper and they are more confidential. So the pregnant young girls, instead of going to health facilities to seek antenatal care or maybe safe abortions, they end up going the other side. So we need to eliminate them. Health work attitude is also another key issue that must be addressed. And here we need to engage the midwives unions, the doctors associations and things like that. Emergency obstetric and newborn care services, at least we should have basic at lower health facilities and comprehensive at upper health facilities or high health facilities. Skilled birth attendancy, this is also critical. And then lastly, linkages. The global health strategy, the strategy should also address issues of teenage pregnancies, ending teenage pregnancies, eliminating child marriages and domestic violence, because these are underlying factors that are increasing issues of maternal mortality. Yeah, so that's what I want. Thanks.